guy that I got who's going to be the guest on episode 150 next week is the guitar player on tour with Billy Joel.
Nice. Oh, wow. Billy Joel is an amazing artist, one of my favorites out there. And so what's his name?
His name is Mike Del Judas, and he has a real interesting story, which I actually found in Rolling Stone magazine. And as I read this article, I thought, this guy personifies what my listeners of the podcast are striving for. You know, I always gear my show towards the up-and-comers who are trying to learn from my guests each week. And here's a guy that, you know, was doing the same thing, was doing the daily grind on Long Island, and started this Billy Joel tribute band called the Big Shot Tribute Band. And he was having a lot of success with it and really built it up and was playing around Long Island. And make a long story short, is to the point now where he's on tour with Billy and plays guitar and sings with Billy Joel. But his one and only quote-unquote demand to Billy Joel was, I got to still be able to do Big Shot. Because he's been doing the Big Shot Tribute Band for like 20 years. And
this sounds like the storyline of Rockstar.
Yes, I love that movie.
And
my favorite.
And Billy Joel said, "That's fine, man. I totally get it. You know, I understand." So Mike, and he was saying on the podcast that'll come out next Wednesday that he plays with Billy Joel. He does his Big Shot Tribute Band, and he kind of has his own like third band where they just go out and they only perform Mike's own original songs. And he also just got one of his songs placed as the theme song for a new CBS sitcom starring Kevin James that's coming out. So real interesting discussion. I was really happy to get the opportunity to talk to him. And, you know, he was so down to earth, and you get someone like that as a guest and you say, oh, this person's probably going to give me, 20 minutes if I'm lucky. And my show is at least 45 minutes. Well, he just had no time constraints at all. We talked for 63 minutes. So it was a really great interview.
I'm sure you had a lot of information and information that you would want out of him, especially someone like that. That's like I said, like this, like the Rockstar movie, someone that actually they have a tribute band in a sense to someone that they idolize, and then it turns out you now are playing.
Where was he found?
Him.
How did he get found on YouTube, or how did Billy Joel find him? I didn't catch that.
No, the Big Shot Tribute Band is what really kind of put him on the radar.
But I mean, how did Billy Joel? Did they find him on YouTube? Because I think that's how a lot of people are getting found these days. I think
over so many years, they just know that you're performing, right?
Well, I honestly don't remember, and quite frankly, I told the listeners as I was recording the show the other day, I'm not going to have Mike retell the whole story. Go read it in Rolling Stone, because even though it's quote unquote someone of that level, I still want to accomplish what I want to accomplish every week, which is, listen, buddy, I'm going to pull information out of you that's going to help my listeners, because they're all going to want to know, hey, this is possible. I can do my own thing with an eye on maybe someday I reach this kind of level. So I was still asking
we'll have
him
to listen
those.
To the podcast.
Yeah,
I think that's how the new singer, well, he's not new anymore. The latest singer for Journey was found. He was found on YouTube, and he sounds just like Steve Perry, by the way. But he's been singing now for like 10 years.
Yeah, and Mike referred to him during our interview. Yeah.
Very cool. Very cool. So tell us, specifically about the podcast. Who's it catered to? What's it about?
Well, every week I interview a guest that's having success in the entertainment business. I like to really get people's attention by saying I've had guests on who've been on American Idol, who've been on The Voice, who've been on America's Got Talent. I had a Rock and Roll Hall of Famer, a Grammy Award winner, a Las Vegas headliner. I had the lead guitar player for Garth Brooks, and now I'm going to start telling people and for Billy Joel. But, those are kind of the sexy ones that gets people's attention. In other words, I'm not interviewing Bruce Springsteen. I'm not interviewing John Bon Jovi, Katy Perry, people like that, because I'm interviewing people that are having success in the entertainment business, but at a level that the listeners can kind of relate to and say, okay, I can do that, and so I'll ask my guests, how did you get your songs placed in film and television? How are you getting booked at some better venues now? How did you just entirely fund your newest album through a crowdfunding campaign? Because I know that these are the questions
that your listeners have.
Yeah, and that they want to know, well, wait a minute, don't just say, I did X, Y, Z. Tell me how you did it. And so I've been delivering that show on time every week for what'll be 3 years as of February.
And 150.
150 episodes. And what really excites me also is that I'm up to 124 countries around the world where my show has gotten listeners from. It amazes me. I was talking to Jim Florentine. He's a well-known comedian. He's also on That Metal Show on VH1. And I told Jim, that I'm a podcaster too, and that I listen to his show. Mm-hmm. And he said, he kind of looked at me and he says, isn't it amazing, man? Like, all of a sudden you find out that there's like some dude in Sweden that's listening to you. And I'm like, exactly. I look at my data that I get in, like you do, Jamie, and you see Saudi Arabia on there. You see these countries where you go, somebody in that country cares, and that really motivates you to keep doing your show. You say, wow, somebody down in insert country here took the time out to listen to my show.
That's the beauty of podcasting, is it's specific information available on demand on a variety of, there's so many different topics, and what you think is needed in, your hometown or something, it may not be, it could be needed overseas, for instance.
That metal show, that's the one you like, right?
Yeah, that's actually where that business show name came from.
Really?
I was just watching.
Wow.
Yeah, I was watching that metal show.
That.
Yeah,
it's a small world after all, as they say, an hour to the east of us in Orlando.
Yeah,
right.
No, I was watching. It was at the time when I was doing the planning for the radio show, and I was like, I need a name, and I was sitting there watching that metal show, and I was like,
that's it.
That business show. That's literally where the name came from. That's I was watching that program.
Well, the thing about podcasting too is it's really great. And I do look at a lot of the research that's published, on the increasing numbers of people that are consuming podcasts, people that are listening to it. And it's so accessible because if you walk for fitness, if you spend a lot of time in your car, that's usually when I'm listening to podcasts. If you relax at the beach, if you work out, if you travel by plane a lot, these are all great opportunities, great times to listen to a podcast. So I love that people can get it. And, you're talking about all the different platforms. I mean, I want people to go to nhte.net. It stands for Now Hear This Entertainment. And at nhte.net, I have all the episodes there, so you can listen to it right there on the site. But I've also got icons that people can click on to go to iTunes, to Google Play Music, Stitcher Radio, SoundCloud. I probably need to add an icon because I know that my show is also on TuneIn Radio. But I love that it's that accessible that people can get it from so many different places and then listen to it in all these different applications, all these different settings that I just listed.
Chris shared a great statistic yesterday about the growth of the podcasting movement. In 2005, 10% of the public had said that they had listened to a podcast, and it consistently had grown. The statistic is at 37% right now, and so it's got a lot of room to grow in terms of reach out there. And so a lot of people are still finding out what a podcast is, how to listen to them. There's probably people right now that are listening. They're probably saying, "What is a podcast? What is this?"
Exactly.
I didn't know what a podcast was, several years ago. And so, for people that are not familiar with, podcasts, just briefly tell them, what it is. How do they find these shows?
Well, it's primarily done through audio, although a video podcast is out there as well. Chris does this thing at the Florida Podcasters Association meeting every month where he reads what the definition is, and it's anything that's an EPUB file that's published on a consistent basis. So in my case, it's an audio file. Like I said, it could be video, it could be something else, but primarily that's what people think of is primarily audio and maybe video. And, you've got shows. We've got one person in the Florida Podcasters Association. Hers is 5 minutes long. Mine is 45 to 60 minutes long, depending on how hearty a discussion I'm having with the guest. And mine comes out once a week, but you've got people like John Lee Dumas who are doing a podcast every single day. And they cover a wide variety of topics. And that's one thing that people talk about is if you can find the niche where there's not a podcast being done or very few, jump right in because the time is still now to dive into podcasting. And, probably when we come back from the break, we can talk about the doors that doing a podcast will open that I have certainly found in my close to 3 years doing my show.
Yeah, absolutely. He mentioned John Lee Dumas, a tremendous success story. He was just a regular working man, a financial advisor out of San Diego, and he started Entrepreneur on Fire about 3 years ago. And in 3 years, he's made $9 million. And I met him down in Puerto Rico. And he does essentially what I do on the program here each and every morning, just interviews entrepreneurs, asks them like the same 10 or 12 questions, too. It's a very predictable interview that he does each and every day on his podcast. But he's a tremendous success story. And there's a lot of those people out there. And there's a lot of industries and topics where people, where there's a demand for this type of information. You can be very, very niche, very specific. Like yesterday at the podcasting workshop, we heard from a guy who has the colon cancer podcast, spoke to his experience with colon cancer, how he talks with caregivers, other people that are being afflicted with the disease, and how he's gotten sponsorships and a lot of reach and has helped out a lot of people through the colon cancer podcast. And so a lot of opportunities with the podcast. interesting.
I think sometimes you may think your subject is too narrow or not big enough, but you'd be amazed. There are so many people that can relate to you, no matter how micro niched you think you are. There are people that can relate to you, and that just makes you more specific. So the more micro niche, the better.
Absolutely. And again, currently talking to Bruce Wozniak, founder and president of Now Hear This Entertainment. Learn more about this, nowhearthis.biz. You're listening to That Business Show with Jamie and Kelly, where business becomes show business.
How many times have you said to yourself, I wish there was an app for that? Stop wishing and start making the world better. Turn your brilliant idea into a profitable business by using Popcorn apps. Their affordable app design will help get your blue sky idea or proven business to the next level at a fraction of the cost of other developers. They will help you get through all the steps needed to make your thoughts become live. See them at popcornapps.com with a K in popcorn, or call them at 727-415-6705 for your free consultation and pop your kernel of an idea into $1 million business and a world changer starting today.
Teresa Turner is a certified public accountant and the founder of Tax Happens, a boutique-style CPA firm providing small businesses and individuals with hands-on, personalized tax and accounting services. Although we would love to tell you how happy their clients are, we would like you to see for yourself. Tax Happens has 21 Google reviews and a 4.8-star Google rating, 17 Yelp reviews and a 5-star Yelp rating, 38 Facebook reviews and a 4.9-star Facebook rating. What sets Tax Happens apart is number 1, upfront pricing, 2, clear deadlines, 3, personally available year-round, and number 4, a willingness to empower clients to do as much or as little as they desire. Visit taxhappens.com for more information.
Have you ever tried to buy a home for your family only to find out that you don't qualify for a mortgage loan? You thought that after 20 years as a customer of your bank, they would help you when you needed it the most, right? Unfortunately, the banks of today are not the banks of our parents and grandparents, and our relationships with them just don't matter anymore. My name is Frank Cotto, and I'm the president of the Lincoln Lending Group. We all may need a bank, but we also need a Frank, and that's what I'm here to do for you today. Lincoln Lending Group will waive all of your lending fees, which include your mortgage, application fee, your underwriting fee, processing fees, and any bank points. Just call 813-MORTGAGE. You drop the E, and we'll drop the fee.
In an age when the good and the better vie for attention, it is the best that stands out. The best of Tampa Bay from Proudly Florida is the love story for the city of Tampa, celebrating success, sharing achievements, a tribute to enterprise and community spirit. Let Proudly Florida showcase your business to your city, your nation, and the world. For more information, email info@proudlyflorida.com and be sure to visit proudlyflorida.com. If you've been following That Business Show on Facebook and Twitter, you may have noticed the quality of some of our images. That's because one of our sponsors is pro photographer Rick Taseda, a member of the Professional Photographers of America. You can view his extensive work by going to his website at ricktaseda.com or call him for an appointment to chat about your photography needs at 813-641-4757. That's 813-641-4757. Rick Taseda Visuals. Call him for your next event or project.
Savvy business owners utilize technology to connect with customers, communicate among teams, and collaborate with partners. Even with advances in technology, you all know it's not infallible. Where do you turn when your technology starts working against you? Who do you depend on to keep your team productive? Don't wait until your technology fails you. Get ahead of the crisis and contact the professionals at Alpha Computing Solutions so they can show you how to keep your technology running smoothly. Visit them online at www.alphacomputing.com.
Who doesn't have a smartphone these days? And of course, there's an app for everything. Well, almost everything. That's why the folks at Popcorn Apps started developing mobile applications. They saw people like you with genius ideas, unable to make those thoughts a reality. They develop applications for tens of thousands of dollars less than you'll find anywhere else, and will turn your idea into a reality in a matter of just a few months. Think you're not ready? Think again. They are your one-stop shop for mobile application development. See them at popcornapps.com with a K in popcorn, or call them at 727-415-6705 for your free consultation and pop your kernel of an idea into $1 million business and a world changer starting today.
Stop for the ride if you're heading southbound along the Veterans Expressway from Ehrlich down into Spruce Street. An accident there has been blocking the right center lane. And a wreck reported in Pasco County along State Road 52 east of Little Road at Chicago Avenue. That has a lane blocked. See traffic problems? Call the injury firm of Abrahamson and Uterwick Hillsborough traffic tip line at 866-545-9595.
This report is brought to you by the Crohn's and Colitis Foundation. Someone you know is suffering from Crohn's disease or ulcerative colitis. They're dealing with excruciating pain and days when they won't be able to get out of bed. Help someone you know and support the Crohn's and Colitis Foundation of America at ccfa.org.
Today, mostly sunny and pleasant, high 77. Tonight, partly cloudy, low 65. Tomorrow, a mix of sun and clouds and warmer, high 81.
You're listening to That Business Show with Jamie and Kelly on 1250 Winds WHNZ. Missed the show? Then head over to TampaBayRadio.com, where all shows are available on demand. Once again, here are your hosts, Jamie and Kelly.
And welcome back to That Business Show with Jamie and Kelly, where business becomes show business. Talking about podcasting with Bruce Wozniak, founder and president of Now Hear This Entertainment. Learn more at that website, nowhearthis.biz. And Bruce, you're mentioning, the doors that podcasting can open, in your business. What has it done?
Well, so you have to keep in mind that as much as we're talking about my podcast, the core of my business is actually management, promotion, and booking of entertainers. So, that's the spinoff. That's why when I first launched it, I thought, hey, this will just be a cool marketing tool for my business. I didn't know that it was going to turn into what it is today. But I have always had this opinion, and I'm sure you do too, that there's no such thing as having too many contacts.
Right.
And so to me, every week when I do my podcast, I am now making a new contact because all of a sudden I'm building a relationship with that guest. In fact, when I travel or if someone's coming through Tampa and there's an opportunity to meet someone who's been on my show that I probably only did the interview with via Skype audio, well, now I want to meet that person and sit down and have breakfast or have lunch and maintain the contact, but also I want to get a photo with them so that I have social media content. And what that does is it gives me an opportunity to plug a past episode of the show because people will see that picture on Facebook, on Twitter, on Instagram, whatever, and I'll say, Bruce Wozniak with Kelly Wilson, who was the guest on episode such and such, and you give the link and they do that. But, a cool example is, so one of my clients, she's a singer-songwriter in Austin, Texas, and I was contacted by a company that was doing a major event, and they wanted her. She was very much on the radar. Oh, we're fans of hers, kind of thing. And they wrote me and said, could she perform at our event? Well, as luck would have it, she's going to be out of town that very weekend. So what I did was I right away pulled up the mental Rolodex and I wrote them back and I said, well, she's not available that weekend, but I can get you so-and-so, and gave a link to that performer's website. And this was someone who had been on my podcast. And I thought, now what artist out there is going to turn down a gig, and who's going to write me back and say, hey, wait a minute, fella, I was on your show, but you can't go booking me. They'll take all the work they can get. So just because of my podcast, I didn't have to miss out on that booking. And so now that kind of opens up something new where maybe this company in the future, because they did say, well, we really like your client so much that in the future we will come back and ask for her for something else. So I like that there's going to be another opportunity for her, even though she missed out on the first one, but that I was still able to fill this void that they needed at that specific time. And then there's really cool things that happen, again, that wouldn't happen for me if I didn't have a podcast. I've been invited to go out to NAMM in Anaheim next month. That's the National Association of Music Merchants. It's an enormous event, 100,000 people over the course of 4 days, and they have 1,600 exhibitors there. And Tascam has invited me to come and do my podcast from their booth.
That's exciting. So what does it stand for?
National Association of Music Merchants. It's enormous. It's a huge event. So I'll be there next month, and then in Orlando in February, I'll be at Podfest, which again, these are just doors that are opening because of my show. And then I've applied to be a speaker at CD Baby's Do It Yourself Music Conference next August in Nashville. Hopefully they'll choose me. But I know that that's really based on what I do with my business, but I know that having the leverage of the podcast will certainly add some muscle to my application too. And I'm even putting together a presentation that I plan to submit to the folks that put together Podcast Movement with the hopes of being a speaker at that event too.
Well, it's time goes so fast. I can't believe this year is almost over. But we say that every year, and just like you, when you first start out with the podcast or with anything that you do, it may seem like there's so much work to do. It's going to take you so long to build up the following. But before you know it, years have passed. Like you said, now you're hitting number 150, episodes. So just putting in the time, eventually, you build up the following.
Yeah, absolutely. And that's really a mirror of what I preach in my business to these performers that, as we said, and now we're coming full circle at the start of the conversation, like Mike Del Giudice, that if you're willing to put in the time, if you understand that it's not going to happen overnight and you get the reps, then eventually you'll start to see some success. And for me, putting in all this time with my podcast and now being in 124 countries and getting invited by Tascam, we want you to come and do your show from our booth at this show in Anaheim in January. You really start to see the fruits of your labor.
And you can be up and running for just a few $100s. You get a microphone, computer, basic audio equipment, Skype. You don't need a radio station to start a podcast either. You can start a podcast for under $300-400, and really the bulk of that is just the microphone and so maybe an audio mixer or something if you're doing an
interview. A lot of the laptops have all of that already integrated into it? I mean, for a beginner to get started? And then
yeah, I mean, you get a basic. If you want to get a good mic, though, that has good sound and everything, you want to invest in that, because that's a complaint with a lot of podcasts is that they use low quality. They use low quality equipment and everything. But if you get a good quality microphone with good sound, you definitely will attract more listeners.
But then you have to have good content. Don't forget that.
Absolutely.
And good content.
You can have the best equipment in the world, but if you're talking about a whole bunch of nonsense, then people are going to tune out pretty quickly.
Right.
Oh, a good discussion. Bruce Wozniak, real quick, your podcast available on iTunes. We're at
iTunes, Google Play Music, Stitcher Radio, SoundCloud, and start at nhte.net, and there will be icons that you can click on to go to those, or you can just listen right there.
All right. Bruce Wozniak, founder and president of Now Hear This Entertainment. Learn more, nowhearthis.biz. You've been listening to That Business Show with Jamie and Kelly, where business becomes show business.
Hi, I'm Kelly Ham from Billmeyer Ham Consulting. Did you know that one of the biggest challenges that leaders face is getting their employees to be engaged, motivated, and producing amazing business results? At Billmeyer Ham Consulting, we'll help you transform your workforce culture from one that might be underperforming, maybe mediocre, to achieving amazing business results. You see, we realize that your workforce culture is equally as important as your business plan and your business strategy. The two must be aligned in order for you to reach your desired business and financial goals.
Carol,
hey Jim.
I just got this plan that could really help with our process here.
Okay, why don't you just have a seat and let's go over it.
Let us help you transform your workforce culture by leveraging your most important assets, your people. I want to know what's going on in your organization. Let us help you transform your workforce culture. Let's have a conversation.
I feel guilty that I can't always be there when Mom feels stuck at home. She was always there for us. But now she can't get out, and I'm not always available to take her places. Someone else needs to help her get around. Then I learned about Home Instead. Now Mom can do what she enjoys because her personal caregiver is there, and I can just be a daughter again.
Are you struggling to care for your loved one? We can help. Home Instead Senior Care. To us, it's personal.
Now, there's a girl in India who has dreams bigger than her village. Right now, there's an elder in Guatemala who dreams of a life of greater dignity and less loneliness. You can help change the future of one person in a single moment. Begin the change at unbound.org.
1250 Winds Weather Center forecast. Partly sunny skies today. Nice day overall, mid to upper 70s, lower humidity as well. Lower 60s tonight for the low. Through the weekend, right back into those lower 80s. Look for a chance of showers Sunday. Impact Radio, 1250 Winds, WHNZ.
You're listening to That Business Show with Jamie and Kelly on 1250 Wins WHNZ. Missed a show? Then head over to TampaBayRadio.com, where all shows are available on demand. Once again, here are your hosts, Jamie and Kelly.
Hey, welcome to That Business Show with Jamie and Kelly, where business becomes show business. We're here Monday through Friday, 7 a.m. to 9 a.m. on Tampa Bay's 1250 Wins Live, and you can also find us all across social media and across all the multiple podcasting platforms, iTunes, Stitcher, Google Play, just to name a few of them, and learn more about this program over at TampaBayRadio.com. Our guest for this segment is Dr. Erica J. Crall, owner of the Tampa Bay Direct Care Network, and you can learn more at that website, TampaBayDirectCareNetwork.net, and he's a returning guest to the program, so we welcome him back in. Dr. Crall, welcome in.
Welcome.
Thank you, Jamie and Kelly.
And so you practice in an area of medicine that is unique and not well known just yet, direct primary care. Tell us what this is.
Yeah, the wise men and women in healthcare have realized that the solution to the debacle we're in is to start using insurance for what it was meant to be used for, just covering for catastrophes, and then pay for your primary care out of your pocket. So that's where direct primary care comes in. It's basically a very simple membership model, just like a gym membership, where you're paying a low monthly fee and all of your primary care is included for that. So you're not paying co-pays. And
now, do you take insurance at your practice?
No insurance at all. That's why the cost is so low, because we just work directly for our patients. We strip the overhead that's involved with billing insurance, and our patients get the savings for that.
And it's more of a membership-based concept. So explain that a little bit.
Well, you basically are budgeting all of your primary care for the entire year into a low fixed monthly amount. So then you never think about cost the entire year. If you need to go in, you get in the same day. If you want to email or text your doctor with a question, you just do it.
Low fixed monthly amount sounds very appealing, and I'm sure to myself and to many listening.
Exactly.
Now, this is this related to, or is this similar to concierge medicine? We've heard that before.
Yeah, it's the same idea. It's just a lower cost because the overhead of insurance is stripped out. So concierge docs do the same personalized service, but they also bill insurance, so they have higher costs. So you're looking at $1,500 a year for a concierge doctor. For a direct primary care doctor, it's anywhere from $50 to $70 or $80 a month.
Now, isn't this a big sacrifice, though, on your part and other doctors who are not going to take insurance, that are going to operate on a cash basis or direct primary care? I mean, aren't you giving up a lot in terms of, revenue opportunities?
Oh, that's a great question.
Probably a lot of headache, though.
I'm not sacrificing anything. I'm getting my life back. Mm-hmm. I'm getting 2 to 3 hours a day that I would have spent doctoring notes to be able to bill insurance, and going home 2 to 3 hours earlier. I'm spending an hour with my patients, getting to know them. It's basically practicing medicine the way it was meant to be practiced.
The way it should be.
And taking my personal life back. So no sacrifice whatsoever. And I'm not sacrificing income or financial security because the overhead is low. Mm-hmm. So you achieve the same end with many fewer patients, and you get your life back.
Now, you're building a network here, the Tampa Bay Direct Care Network, and when you go to this for doctors and trying to get them to join your network, I mean, I'm sure you're getting pushback, just like the question that I asked is, well, if I can't take insurance, I'm going to be losing this opportunity and losing that opportunity. How do you overcome those objections?
Yeah, that's true. I thought that the easiest sell would be to the doctors. It's like, hey, just do like I'm doing and take your life back. But doctors fear change. They fear loss of financial security. And so it's really a matter of educating them on all of the innovative solutions that are available now, where they can have an EMR that's free. They can get their malpractice insurance for a low cost. And then the availability of joining the Tampa Bay Direct Care Network allows them to have an influx of patients through my contacts with small businesses to offer this benefit.
Back. Right? And to have their life back. And I would think, you have to be able to adapt to change with and who knows what's going to happen now as we get into the new year with the new presidency. And I'm sure things will change, but it's going to take quite a bit of time. So you have to be able to adapt. And what better way?
Yeah, Now, your network is not just a network of primary care doctors. You're filling in the voids of the different specialties, too, within medical care, too, from people that do the MRIs and the X-rays. I mean, am I correct in that assessment right there?
True. When you purchase a direct care doctor, you're buying an advocate that basically directs you for the lowest cost MRI or X-ray, the lowest cost lab services, the specialists who cater to self-pay. So I'm helping people spend less so they get their high deductible plan, which they're saving hundreds a month on premium, and then I help them not spend their deductible because it costs very little to see me, and I direct them to all the lowest cost services.
Now, have you been able to fill all the voids in your network with the different care providers, or are there certain areas where you're still needing certain service care providers in certain areas?
Well, we don't provide the specialty care necessarily. The network is just the connection between the businesses and then the primary care doctors. So we've filled in the void very successfully with labs, x-rays, and prescription.
That's what I'm saying. So you've got all of them. You're not needing a certain provider right now?
That's all in place.
It's all in place right now. So how can consumers out there leverage the Tampa Bay Direct Care Network to lower healthcare costs? You're saying 30 to 50%.
Right. The first speaker today talked about automate, delegate, eliminate. What better way to eliminate expense from your bottom line by getting rid of about half of what you spend on health insurance? So once you have a doctor, or you're providing for your employees a doctor they can see whenever they want to, now you can really just get a stripped down catastrophic insurance plan, and the cost for that is at least half of what it is for a traditional plan. It comes back to using insurance for what it was meant for. This debacle started in the 50s when we started offering full coverage for everything. We shouldn't be covering primary care. The analogy I like to give is car insurance. Our car insurance would be unaffordable just like our health insurance if we used it to pay for oil changes and tire rotations.
So people could pick up the phone right now, call their healthcare service agent and say, I don't want, basic primary coverage. I want to just be covered for, catastrophic coverage.
Absolutely, yes.
Does it still fall in line then with the regulations of the Affordable Care Act to have insurance? How does all that come into play?
Oh, yeah. As long as they pick a catastrophic plan which meets the minimum essential elements of coverage, then that does meet the requirement for having insurance.
So they don't need to be covered for the primary care, the annual visits as part of the Affordable Care Act.
They do not. They can purchase that on their own at a low cost. And people have been afraid to do that because now you have to shop for everything yourself. That's a risk. It's not a risk when you're paying a low monthly membership fee to your doctor who's going to help you go through the whole maze of the system and save money, save your deductible.
Now, this time of the year, open enrollment, everybody's kind of getting sticker shock with premium rates increases 20 to 50, even to 100% in some states. Do you see an increase in your business, direct primary care, right now with people coming to you and saying, hey, I need a better alternative here?
Absolutely. Every year in November, December, when people see the sticker shock and they're looking for other alternatives, we get the calls. This is a big time of year. And it's really educating people on what is the cost if you don't have a direct care doctor? All those extra copays and the extra specialist visits and the imaging tests that your regular doctor is going to send you for all the time. When you have a doctor you can spend an hour with and get to the root cause of problems,
and really build a relationship with, at that point, a patient doctor relationship. Unfortunately, it seems like everyone keeps getting canceled too. You go through all of the work to find the insurance and go through the whole system of what you need. You finally find it. And if you, hopefully you can at least last the year. But if not, so many get cancellation letters, and then they know we have to go through this all over again. I have to do this all over again. And a lot of times they'll find a plan then that their doctor is now not on. So they went through all of that, and then now they found a new doctor, and now they're canceled. And now when they change, now that doctor's not on it anymore.
You never have to change when you have a direct primary care because there's no third party that's interfering in that relationship.
Guys, did you practice traditional medicine and then go to the direct primary care model, and because you saw the ease of doing DPC care?
Absolutely. I practiced for 17 years for a large healthcare system in the area, and it was basically the extra time spent just to bill for insurance, and it was also the fact that doctors are being graded now on how well they do certain things, and we can't control whether our diabetics are doing great or not. We tell them what to do, but it's up to them. So it's unfair to grade doctors on all these metrics which we can't control. So I could see that was the direction the system was going, and fortunately I knew about this model from contacts out in Seattle and North Carolina. So
I was going to say, what's the prevalence of this model across our country right now in terms of overall percentage? Is it still in its infancy right now?
Definitely infancy. 2 years ago, 22 states had direct primary care. Now 40 states have it, and it's estimated that probably only 2 to 3% of primary care doctors actually practice this way, though. And in the Tampa Bay area, there's only about 3 of us. I happen to be the only one that I just do only direct care. Some docs are afraid, like you said, loss of security. So, they'll bill insurance and see how this direct care thing goes. But I think you have to just do it nothing but direct care.
But aren't you also up against a huge, wall with the medical community out there? You're kind of setting a new standard for medical services out there, a new way of doing healthcare. But all the doctors that are, entwined with insurance and the insurance companies themselves, I mean, you've got a big battle in front of you, would you not say, to kind of get this model to the forefront? How are you overcoming, that?
It's more of a battle than I thought. But like I said, it's educating the doctors so that they realize that they're not really going to lose any income. They're going to gain their life back. And, I can help them by building the network and giving them access so they can grow their practice. It took me 2 years to grow my direct care practice. I mean, I could help a doctor transition away from the typical system and grow a direct care practice, grow their membership, within a year.
So people right now that are listening, and I'm seeing it all over social media, oh, my healthcare costs have doubled, oh, they've tripled. They could call their service agent right now and say, listen, I don't need, this, basic care coverage. Just give me the basics that meets the Affordable Care Act. And you're saying they can cut their premiums in half as long as they just absorb the cost for their direct primary care. So that's a solution out there for consumers right now today?
Absolutely.
Wow, incredible. So
Sounds
people
good.
out there looking for solutions, got to reach out to Dr. Crall or your agent right now and then ask him those questions. Do the agents even know about this when people call, or do you even know when they talk to their service agents?
Are you working to connect with many?
Yeah, I have. The
You have to
agents.
educate them,
the
too.
agents are aware of it, but they don't. They make less money by people selecting lower cost plans, so they're not really motivated to.
And they already took a
discuss
big
that.
cut over the last few years, the health insurance agents, with the changes in the models, and a lot of them had left the business, and so they're already not making a lot in terms. They're getting like a flat fee now instead of commission when it comes to health insurance sales.
A lot of changes.
So definitely a solution out there for people having some issues with their premium costs. Just be willing to absorb the cost of your annual visits and other. What is involved specifically in terms of what the insurance would cover versus what you would cover as a direct primary care doctor.
Well, it's everything that you would go to a primary care doctor for. It's the wellness visits, sick visits, acute injuries, joint injections for bursitis. EKGs, lung function tests, skin biopsies.
So all that would
freezing
fall.
off
Okay.
things. Those are all part of the membership. You're not paying, extra for all that stuff.
Freezing off things. Is that what you just said?
I did, yes. Warts.
And what about prescriptions? How do prescriptions fall into all of this? Is that something that would fall under their health plan, or is that something that is part of this network in some way? How do the prescriptions
That's
work?
not something I had to come up with on my own. Those low-cost discount programs are available out there for anybody. And GoodRx would be the most noteworthy one, where anybody with or without insurance can go to GoodRx, download the app, and any prescriptions that they have, you can find out what the discounted prices are at all the pharmacies around. So, that's not necessarily part of my network. It exists. People just have to know about it. And that's where having your advocate that knows where all of the low-cost options are is valuable.
So where do you recommend people listening right now start? Should they call their insurance agent? Should they call you? Where should they start right now to learn more about this?
Well, basically, they need insurance. So, yes, an insurance agent, and making it clear that you're going to buy your primary care on your own. So you don't want an insurance product that includes primary care. You just want a catastrophic, high-deductible plan, and make sure it's compliant with the
Start
ACA.
there, and then
Start
go
there.
visit Dr. Crall when you need the basic annual visits and the other wellness checkups, and learn more about this at the website, tampabay-directcarenetwork.net, and his phone number, 813-321-1783, 813-321-1783. Got another segment with him when we come back from the break on That Business Show with Jamie and Kelly, where business becomes show business.
Are you in need of new flooring or ready to tackle that home remodeling project? Then contact Yeager & Company Incorporated, a family-owned, state-certified general contracting business with over 70 years of experience and the recipient of the Angie's List Super Service Award for the last 8 years in multiple categories. Yeager & Company comes to you with their shop-at-home flooring sales service, and their hardwood flooring refinishing is the very best in the Bay. Kitchen and bath design featuring American-made, well-born cabinets, and all work is done by employees, not subcontractors. Learn more at YeagerFlooring.com.
If you've been following That Business Show on Facebook and Twitter, you may have noticed the quality of some of our images. That's because one of our sponsors is pro photographer Rick Taseda, a member of the Professional Photographers of America. You can view his extensive work by going to his website at ricktaseda.com or call him for an appointment to chat about your photography needs at 813-641-4757. That's 813-641-4757. Rick Taseda Visuals. Call him for your next event or project.
Savvy business owners utilize technology to connect with customers, communicate among teams, and collaborate with partners. Even with advances in technology, you all know it's not infallible. Where do you turn when your technology starts working against you? Who do you depend on to keep your team productive? Don't wait until your technology fails you. Get ahead of the crisis and contact the professionals at Alpha Computing Solutions so they can show you how to keep your technology running smoothly. Visit them online at www.alphacomputing.com.
Who doesn't have a smartphone these days? And of course, there's an app for everything. Well, almost everything. That's why the folks at Popcorn Apps started developing mobile applications. They saw people like you with genius ideas, unable to make those thoughts a reality. They develop applications for tens of thousands of dollars less than you'll find anywhere else, and will turn your idea into a reality in a matter of just a few months. Think you're not ready? Think again. They are your one-stop shop for mobile application development. See them at popcornapps.com with a K in popcorn, or call them at 727-415-6705 for your free consultation and pop your kernel of an idea into $1 million business and a world changer starting today.
Teresa Turner is a certified public accountant and the founder of Tax Happens, a boutique-style CPA firm providing small businesses and individuals with hands-on, personalized tax and accounting services. Although we would love to tell you how happy their clients are, we would like you to see for yourself. Tax Happens has 21 Google reviews and a 4.8-star Google rating, 17 Yelp reviews and a 5-star Yelp rating, 38 Facebook reviews and a 4.9-star Facebook rating. What sets Tax Happens apart is number 1, upfront pricing, 2, clear deadlines, 3, personally available year-round, and number 4, a willingness to empower clients to do as much or as little as they desire. Visit taxhappens.com for more information.
Have you ever tried to buy a home for your family only to find out that you don't qualify for a mortgage loan? You thought that after 20 years as a customer of your bank, they would help you when you needed it the most, right? Unfortunately, the banks of today are not the banks of our parents and grandparents, and our relationships with them just don't matter anymore. My name is Frank Cotto, and I'm the president of the Lincoln Lending Group. We all may need a bank, but we also need a Frank, and that's what I'm here to do for you today. Lincoln Lending Group will waive all of your lending fees, which include your mortgage, application fee, your underwriting fee, processing fees, and any bank points. Just call 813-MORTGAGE. You drop the E, and we'll drop the fee.
In an age when the good and the better vie for attention, it is the best that stands out. The best of Tampa Bay from Proudly Florida is the love story for the city of Tampa, celebrating success, sharing achievements, a tribute to enterprise and community spirit. Let Proudly Florida showcase your business to your city, your nation, and the world. For more information, email info@proudlyflorida.com and be sure to visit proudlyflorida.com.
Still a stop and go right if you're heading southbound along the Veterans Expressway a little past Ehrlich, all the way into the Courtney Campbell Causeway. A couple of earlier accidents here have cleared, and reports of an accident westbound along Kennedy at Albany. That's just before Howard, blocking a left lane. See a traffic problem? Call the injury firm of Abrahamson and Uterick Hillsborough Traffic Tip Line at 866-545-9595.
This report is brought to you by the Foundation for a Better Life.
Would you be mine? Could you be mine? Won't you be my neighbor?
Hi, neighbor.
Mr. Rogers passed along friendship, hoping we would too. Friendship, pass it on from the Foundation for a Better Life at values.com.
Today, mostly sunny and pleasant, high 77. Tonight, partly cloudy, low 65. Tomorrow, a mix of sun and clouds and warmer, high 81.
You're listening to That Business Show with Jamie and Kelly on 1250 Wins WHNZ. Missed the show? Then head over to TampaBayRadio.com, where all shows are available on demand. Once again, here are your hosts, Jamie and Kelly.
And welcome back to That Business Show with Jamie and Kelly, where business becomes show business. Talking about direct primary care with Dr. Erica J. Crall, owner of the Tampa Bay Direct Care Network, and learn more at that website, TampaBayDirectCareNetwork.net. So, Dr. Crall, how does my business get a return on investment when I offer health benefits with direct primary care as the core offering?
Two ways. Number one, the cost of giving all your employees their own doctor is very low, a low monthly amount of $70, $80 a month. but it's the savings that you get on providing the catastrophic care. So, a typical policy for an employee may be $400, $500, $600. Well, you strip that down so that you're only giving them a catastrophic policy. They could get that for maybe $200 per employee. And then you give them the primary care along with it. So it's not just the 50% lower cost. It's the fact that you're giving your employees an actual health benefit so they can get better quicker. They can get better control of their chronic illnesses. It's a health benefit. So it's not just that you're saving money. You're actually doing what you really intended to do anyway, but the typical insurance plans now don't provide a benefit. They just give them a high deductible, and they have to go pay everything themselves anyway.
Well, and you're providing a doctor. I mean, as a business, an employer, you'd be providing a doctor in a relationship with a doctor in a sense where, like you said, you'll spend the time with them and talk with them and answer all their questions, and where a typical doctor can't. They're in and out. They have to, and they're typically an hour behind in all of their appointments through the day. So, it's a different patient relationship.
And to your point, Kelly, most of the companies are now realizing that if they give a teledoc service where, they'll say, you can call this number and get your questions answered, or on-site clinics, a lot of companies are doing that. They're realizing that does give their employees the ability to go somewhere when they're sick, but their employees do not get engaged in their health and wellness when you're just giving them a teledoc or an on-site clinic. When you give them a primary care doctor that they can call, email, text, go see, spend an hour with, they become fully engaged in their health and wellness. And so that's where you get less absenteeism from work. You get people that now they can focus and concentrate on the job because their ADD is treated.
Right.
Or every time they get a cold,
that
they don't
seems to be a big problem for everyone. No, I see the value. I think it's great.
Wow. And so what are your service areas for yourself for Forget, make sure we get that out of there. Where do you cover?
I cover the north part of Hillsborough County, Tampa, North Tampa, the east-west corridor of 54, and then I'll have physicians in the entire Tampa Bay area, Clearwater, Largo, St. Pete, South Tampa, Brandon.
And how long have you been growing the network now?
For about a year.
About a year and everything.
I've been doing it myself for 2.5 years, and now it's just getting the network going.
So I've heard you've had to educate the insurance agents, you've had to educate the doctors, the insurance companies, the business owners.
Right.
It sounds more like you're a salesman out there just trying to educate people on this.
He's a pioneer. He's one of the frontiers of this direct care.
It's a simple concept, but it's so complicated for people to understand because it's simple. So it's getting them to realize that the cost of not doing this far outweigh the cost of doing it.
Right. And you mentioned teledoc service earlier, or just in that last talking point. How is your service much more valuable than people out there and saying, well, I could just use this? Sounds like a teledoc service.
Well, yeah, you're getting a physician that you can see anytime. The teledoc service is just calling and, if you need a prescription, they'll call it in for you.
Is that through video, or is it just you're just on the phone with them, or how do...
They do some video visits as well. A lot of it's just on the phone.
Okay.
But yeah, you're getting a physician that knows you and everything about you that you can see. And it's not that much more than what they pay for teledoc. I think teledoc services are $29 or $39 a month.
And you don't have to worry about losing your doctor privileges. If your insurances change or anything, those specialists that you might need, you can go to, but your main primary care physician will never change.
Right. And if you stop working for the employer that was paying the membership for you, it's still low cost. You can start paying it yourself if you change jobs.
Well, for a lot of small business or entrepreneurs out there that want to get out of the corporate world, if they're still trying to hang in there because of benefits, it gives them another option. Go start the business you want to start. Get out there, make it happen, kind of like we talked about earlier in the segment regarding the podcast. Time goes so fast. Just start. But healthcare is always a reason I think people stay in corporate. So
people should not be handcuffed to do something they don't want to do just so they can have benefits.
How can business owners get more information on offering this to their employees? Do you do any type of regular seminars or webinars, or where would they start to get some more information on how to implement this?
Just start at TampaBayDirectCareNetwork.net. There's a section for employers, a section for physicians, kind of explaining the value of it, what we provide to the network. And contact me. I'd be happy to come talk to the employees so the employees understand the benefit they're getting. Yes.
Sounds good.
Well, a revolutionary here in the healthcare industry, Dr. Eric J. Crall, putting out direct primary care insurance. So talk to your health insurance agent this open enrollment period about just having catastrophic insurance coverage and then using Dr. Crall for your direct primary care stuff. And you can definitely save some money, 50%, 30 to 50% or so, he says. So, Dr. Crall, good discussion. Thank you so much. A lot of information here.
Thank you, Jamie and Kelly.
And again, learn more about his network at that website, TampaBayDirectCareNetwork.net. Again, TampaBayDirectCareNetwork.net. I know that's a long one, but just write it down. It all flows.
Yeah, and check out that GoodRx app,
oh,
right?
Yeah,
GoodRx.com.
Yeah, save some money on your prescriptions through that GoodRx.
Looks like a cool app.
Hope everybody has a great weekend. Be sure to tune in again Monday morning at 7 a.m. and learn more about this program over at TampaBayRadio.com. You've been listening to That Business Show with Jamie and Kelly, where business becomes show business.